our community, showcasing the talent of our high desert communities. Our Community, presented by CYAP, serving to educate, inform, and inspire the citizens of our communities. Hosted by Jiles Smith. Civic leaders, law enforcement, and education officials who are dedicated to making our community, as our one nation under God, a safer, happier, more productive, and more prosperous place to live.
This is our community, baby.
Our host on Our Community, Jiles Smith.
Thank you, Terry. Our goal for this next half hour is to help educate, inform, and inspire you, the people of our community.
On Our Community today, we welcome the Executive Director of First Five, Karen Scott.
Thank you.
So Karen, first question. What exactly is First Five?
First Five is a program commonly known as Proposition 10, the Tobacco Initiative, which was voted in 1998 by California voters. This initiative created an unprecedented opportunity to invest in the state's youngest children. The local First Five commissions develop and implement approaches to meet the needs of the children locally. We get to design our programs and fund according to what we need in our own unique communities. It's vitally important that the local decision makers retain that ability to make the most effective use of First Five funded programs in direct response to our unique communities. First Five is a funder. I, as the executive director, work with a staff of 24 highly skilled staff, ranging from office support and staff analysts to management and accountants. We're governed by a commission of 7 members. Linda Haugen, the Assistant Executive Officer for San Bernardino County Human Services, is our commission chair. Dr. Maxwell Ohikwari, the Public Health Officer for San Bernardino County, is our vice chair. Supervisor Josie Gonzalez of the 5th District is also a commissioner, as well as 4 others. So First Five utilizes an advisory committee which is comprised of 25 members representing various levels of expertise and collaboration. The advisory committee is chaired by Leslie Agee, who is also one of my commission members. So more than 32,000 children are born every year in San Bernardino County. In each life is an unlimited amount of potential to grow up healthy, to do well in school, and to succeed. First Five believes in tapping into that potential during a child's earliest years, those formative years, and working to ensure that all children are given the opportunity to thrive.
So how was this program funded?
Anchored in research about the critical period of brain development in prenatal through age 5, the funds are generated through the proposition's tobacco tax and are allocated to each county commission. There are 58 county commissions based on the number of live births in that county. We have about 32,000 live births per year and about 160,000 children birthed through age 5. First Five San Bernardino receives about $23 million annually to accomplish the goals of Proposition 10. First Five funds provide a flexible local funding source for services that would not otherwise be available to children and families.
Outstanding.
From the latest funding opportunity offered by First Five San Bernardino, we have contracted for program services in the amount of $57,580,872 to cover the next 3 years to promote, support, and enhance the early development of our children prenatal through age 5, more than $16 million in the area of education to serve 3,225 children in a year, $18 million in the area of family to serve 17,000 children and families a year, more than $20 million in the health focus area to serve 26,475 children and families a year. And in our systems integration focus area, we've invested more than $2 million, whereby partnering with community organizations, we are able to effectively outreach to our target audience through system support, community events, and community education.
Can you tell us more about the First Five strategic plan?
Yes, the strategic plan is our critical guiding document that is reviewed annually and updated periodically to ensure that it reflects the new state initiatives, evolving trends, and emerging needs, demographic shifts within our own county. First Five strategic plan is based on 5 goals. Children are safe and healthy. Children are ready to enter and succeed in school. Families are safe, healthy, and nurturing and self-sustaining. Systems are responsive to the needs of children. families, and communities are engaged and empowered to meet the needs of children and families. These goals align with what is required of us to be reported to First Five California as a recipient of Proposition 10 funds in the results areas of improved child health, improved child development, improved family functioning, and improved systems of care.
What are some of the key areas that First Five wants to support?
Our key areas are health, early care and education, family support, systems integration, and community engagement. Under the health strategy, which is a big one, First Five strives to identify children who are at risk for developmental delays early and to provide necessary interventions so that children will achieve their full potential. Health is a broad and complex issue that encompasses the physical and social emotional health of the child, as well as that of pregnant women and the children's caregivers. Access to regular care and treatment, as well as the early interventions, is necessary for children to experience healthy development. First Five has made child health and well-being a priority in our funding. Approximately 35% of our total budget, our total commission investment, was earmarked to health in the amount of $13.7 million in fiscal year 2010-2011. First Five funded 9 healthcare access partners during fiscal year 2010-11, which included community and clinic-based programs that provide health insurance assistance, enrollment, as well as screenings and treatment to eligible children, parents, and pregnant women.
Well, how can people find out about these programs? Where do they go?
They can go to our website at www.first5sanbernardino.org.
When we return, more with Karen Scott and First Five.
Community Youth Athletic Academic Program, serving to inform, educate, and inspire. Providing after-school sports activities for youngsters, informing residents of resources available, educating those seeking life-improving direction. The annual High Desert Seniors All-Star Football Classic. Top seniors from all area high schools, showcased and rewarded for their commitment to character-building athletics. To learn how you can contribute to the success of the High Desert Seniors All-Star Football Classic, go to www.thecyap.com. CYAP, Community Youth Athletic Academic Program, serving to educate, inform, inspire. It's a gas to go to class, rewarding students for perfect attendance. Victorville Motors Chrysler Jeep Dodge Ram gave away this Jeep in 2012 at its festive gala celebration. Apple Valley sophomore Sydney Toney won the 2012 Jeep Patriot. This year, more schools are involved, and 2 Dodge Darts will be given away. Victor Valley merchants partner with Victorville Motors and contribute to It's a Gas to go to class. It's a Gas, major sponsor of the High Desert Seniors All-Star Football Classic.
We continue with Karen Scott, Executive Director of First Five.
Many families throughout San Bernardino County are struggling to gain self-sufficiency. They face a number of challenges ranging from job loss and rising foreclosures to general lack of economic, social, and material resources. While demand for public assistance and services has increased in recent years, government agencies and nonprofit organizations have been forced to cut or drastically reduce funding to much-needed programs for families and children. In response to these challenging times, First Five San Bernardino has funded a number of agencies under our family support focus area. The funding equates to 25% of our total investment and was appropriated at $9.7 million in fiscal year 2010-2011. The 2 main strategies under family support are parent education and family resource centers. In 2010-2011, First Five funded a total of 8,404 services under this strategy compared to 5,894 in the previous year, an increase of 43%, which clearly demonstrates enormous needs in our county. Through our First Five resource centers, our contract agencies provided more than 17,000 services, including referrals and linkages and case management to families. We expended more than $800,000 in basic needs provisions to help families achieve self-sufficiency. And finally, under our systems integration and community engagement, our goal is to coordinate and integrate with other services to benefit families. In fiscal year 2010-2011, our work helped 62.5% of our stakeholders to form or maintain collaborative relationships to effectively provide services to children and families. So systems integration and community engagement is a robust goal ranging from ensuring awareness messaging of the importance of the first 5 years of life for a child's optimal development, supporting child development campaigns such as our All Aboard the Reading Railroad event to promote the importance of early
I heard
literacy.
a lot about that. Yeah.
Sponsoring child safety promotions through car seat distributions, and funding campaigns such as water safety, safe sleeping, and never leaving a child in a car. Promoting safe surrender awareness, intervening with service support in suspected child abuse cases, analyzing child death reviews, along with other child abuse prevention efforts. In fiscal year 2010-2011, we saw a 40% increase in participation in the annual Read for the Record early literacy campaign. And First Five effectively collaborates with the Department of Behavioral Health to provide the SART program. And First Five funding provides a local match to draw down much-needed federal dollars to provide these services. In the stakeholder interview of fiscal year 2010-2011, 87% of our stakeholders indicated that First Five was responsive to the needs of the community.
Well, Karen, how does drug addiction affect our early birth outcomes?
Our funding decisions are based on data, and the data tells us that drug abuse adversely affects children in our county. The bright side is that our PSART, perinatal SART program, these issues are addressed. Women are actually self-reporting and receiving treatment to ensure healthy babies at delivery as a direct result of First Five funding, along with our other partners in the county, such as the Department of Public Health, the Department of Behavioral Health, and many nonprofit service providers.
Well, how does parents' education fit into this whole programs?
It supports our goals that parents practice developmentally appropriate parenting skills using positive discipline. More than 80% of our participants in the parenting education component show significant increases in their knowledge of brain development, how children grow, and their age-related typical behaviors. Parents learn coping skills and improve their own behavior to ensure increased family functioning. This year, First Five San Bernardino adopted the Nurturing Parenting parent education curriculum so that we can measure more effectively the outcomes in our parenting education component.
Perfect. One of the big challenges that I've identified in others in our community is early reading for children as well as obesity rates. Is that something that First Five deals with?
Absolutely, two of our top priorities. We fund several early literacy programs recognizing the importance of early learning and reading skills for success in entering and achieving positive outcomes in school. Through a Healthy Communities initiative, we have funded innovative projects and collaborations throughout the county that address the high obesity rates in children. There is much work to be done in this area, and First Five sits at the table of many different collaborations for sharing of research and evidence-based interventions, as well as lending expertise in policy development to improve the trajectory of our children.
Does First Five support some bilingual programs as well?
Absolutely. We know that we have a need for providing services in multiple languages, so we do fund programs that offer bilingual staff and culturally appropriate services.
Is there any difference in children's health issues when they account for race and social issues?
Well, as I mentioned before, health is a broad and complex issue that encompasses the physical and social emotional health of the child. Addressing children's health issues is so big on the radar right now at many different fronts, including ensuring health care coverage for all children, promoting proper utilization of benefits, education in the navigation of the health care system and benefits, and support of expanded and comprehensive oral health care, information campaigns on the importance of breastfeeding, on immunizations. Those are the types of things that we are targeting. If the data tells us that we need to focus on a particular socioeconomic class or a particular race, then we look to do that according to our data research. So some of the notable accomplishments directly attributable to First Five funding include a reduction in the percentage of women who drank alcohol in their pregnancies from 25.9% to 19%. a reduction in the percentage of women who smoked marijuana in their pregnancies from 22.2% to 10.8%, and this is from our fiscal year 2010-2011 evaluation data. A reduction in the percentage of women who use drugs such as cocaine, heroin, and methamphetamines from 42.6% to 28.5%. 86% of children are covered by primary health insurance. Through our health access strategy, we know that 2,036 children utilize this insurance and or established a medical health home made possible by health insurance navigation assistance. Support of this strategy reduces the number of emergency room visits and ensures quality care for the child when the parent understands where the child should be in developmental ranges. 86% of children are covered by dental insurance. Through our health access strategy, we know that 15,808 children receive dental screenings and follow-up care that would not have otherwise been possible. Under our early care and education, our focus is ensuring that children live in a home environment supportive of learning, that they develop within normal ranges in all domains, and that they have access to high-quality early development programs. First 5 funding in fiscal year 2002-2011 yielded increases in the number of child care providers that understand and will work towards improving child development milestones. 90% of parents practice counting with their children, 82% practice the alphabet, and 77% practice with the child writing their name. 87% of parents spent time reading aloud to their children, 83% spent time singing, and 61% spent time telling stories to their children. As we measure developmental gains, as many as 86% of children improved or showed progress in 7 domains, measured using a standardized tool. Although these may seem like small and minimally significant things, research shows that all of these activities ensure that the child is eager and ready to learn and succeed in school.
I understand there's over 70 agencies that help you in supporting children and families in our county.
That's correct. And you can find those agencies on our website at www.first5sanbernardino.org.
Is there anything else you want to add?
Yes, First 5 is very proud of its accomplishments. First 5 has recently adopted the San Bernardino County-wide vision that capitalizes on the diversity of its people, its geography, supports a vibrant economy with a skilled workforce, supports a sustainable system of high-quality education, community health, public safety, housing, retail, recreation, arts and culture, and an infrastructure where all sectors work collaboratively to reach shared goals. We strive to align with this vision every day in all of our work. First 5 commissions focus on the first 5 years of life and fund programs and services through fiscally viable organizations. As we build capacity for providing services to our respective constituents, it's important that we all know what resources are available.
Well, I think you're doing a great job.
Thank you very much.
We want to thank Karen Scott again for her role in our community.
Thank you, Giles. It's my pleasure.